Welcome to this video on expanding access to crisis care for veterans. We will analyze the Compact Act of 2023 and its implications for DC and Maryland. I am Rick Radford, an MSW intern with Hope for You, LLC, and a U.S. Army retiree. In May, we are amplifying our community's voices by sharing policy briefs authored by our graduating MSW interns. This brief by Rick Radford translates a complex federal policy into an actionable clinical framework. Veteran suicide is a public health emergency. The Comprehensive Prevention, Access to Care and Treatment, or Compact Act of 2023, eliminates financial barriers to emergency mental health care. However, policy success depends on navigating workforce shortages and complex system coordination. Veterans account for about 13% of suicide deaths in the U.S. Many veterans in crisis are disconnected from VA services and face financial barriers at community hospitals, representing a broken bridge to care. The Compact Act rebuilds this bridge. Key provisions include care at VA or community hospitals, zero co-payments or cost sharing, access regardless of VA enrollment, and coverage for limited follow-up care. The Compact Act shifts from administrative gatekeeping to a public health response. It moves from high costs and restricted access to zero co-payments and open access to any emergency department, prioritizing immediate life-saving care. Federal policy, administered by the VA, funds emergency treatment. However, the structural reality is that the effectiveness of the Compact Act depends entirely on the capacity of local behavioral health infrastructures in places like DC and Maryland. In DC, strengths include centralized coordination and robust mobile crisis teams. Complications involve severe workforce shortages. In Maryland, strengths include strong state-to-regional coordination, but complications include rural geographic barriers. Intersectional disparities mean some veterans still fall through the cracks. These include racial inequities, an information deficit, geographic isolation, and gender gaps, all complicating equitable access to care. The social worker's toolkit includes safety planning, care coordination, using a trauma-informed lens, and ethical advocacy. These clinical integrations are vital for effective implementation of the Compact Act. Mission alignment means fulfilling the 4 R's: reach, restore, rise, and respond. This involves outreach, utilizing zero-cost emergency provisions, navigating systemic gaps, and ensuring robust post-crisis support and follow-up care. The Compact Act is a life-saving framework, but practitioners must make it a reality. Incorporate financial protections into safety plans, educate peers on community eligibility, and advocate relentlessly for equitable implementation across DC and Maryland.